Hello, my name is Lindsay Robert, and this is my video assignment for Module 1 for the Families and Health course. For this assignment, I watched a YouTube video titled The Placebo Effect by Dr. Ben Goldacre. In this video, he explains the role of the placebo effect in medical research and the pharmaceutical industry. Dr. Goldacre mentions that the placebo effect works on nearly anyone, skeptic or not, and that dummy treatments can be compared directly with other dummy treatments. For example, patients who took 4 sugar pills a day healed their gastric ulcers faster than patients who took only 2 sugar pills a day. Dr. Goldacre goes on to point out that the color of the pills being administered make a difference, that blue and green pills are viewed as sedating, and red and orange pills were seen as alerting. This information was duly noted by the pharmaceutical companies, and in turn, they utilize this research when considering medication packaging. Medicine used to treat depression or anxiety often comes in calming green or blue colors. Adversely, stimulants tend to be bright red. They've also found that saltwater injection is more effective in treating pain than administering a sugar pill, even when the pill is designed to look like a painkiller. Neither have any actual drugs, but because the injection is more serious for the patient, it has a more positive effect on their symptoms. So there's all this information, research, and proof. It would seem simple. We should just treat patients with placebos when applicable. However, the ethics of performing this is questionable. Dr. Goldacre believes it would be wrong to treat patients commonly with placebo medication, because in order to do so, you have to lie to the patient, something doctors shouldn't do as it affects credibility in the long run. There is a way that placebo treatments can be performed ethically. Dr. Goldacre believes it can be done by providing treatments in a positive environment, that the way in which treatments are administered will have a placebo-like effect on the patient's recovery. This video mirrors some of what we learned in Chapter 2 of our textbook. The text explains that a placebo is an inactive treatment that may cause improvement due to the belief in its efficacy, making it an excellent example of how psychology is linked to physical health. In agreement with Dr. Goldacre, our text points out that dummy treatments can indeed be compared to other dummy treatments, that research shows larger pills work better than small pills, capsules work better than tablets, name brands work better than generics, and injections work better than pills in general. Additionally, our text goes into more detail on the use of placebos, such as the drawbacks they impose on actual treatment research. Utilizing a placebo in clinical study introduces a new set of potential side effects through the nocebo effect, and patient improvement from placebo use can minimize the positive effects that the true medication has. Our text also discusses the correlation between the placebo effect and expectancy and points out that classical and operant conditioning have much to do with patient improvement. While I was relatively familiar with the basics of the placebo effect, our text reading and Dr. Goldacre's video provided me with much more information. The idea that people can heal themselves and the fact that differing placebo treatments have differing responses demonstrates the power of the human brain. Over the years, I've grown more skeptical of pharmaceutical companies. It's my belief that overprescription of pain medications is responsible for the opiate crisis that much of the country is experiencing. What if short-term or even chronic pain could be treated with placebo? If patients responded well, they will have avoided exposure to dangerous, addicting pain medication. The issue is that lying to patients is unethical, but in order to reap the full benefit of the placebo effect, patients need to believe that they're receiving actual treatment. As mentioned at the beginning of this video, Dr. Goldacre suggests that the placebo effect can be employed ethically by creating a positive atmosphere for patients. If the actual physical environment is comforting, and medical professionals administer treatments in an encouraging, supportive manner, patients should have a better response to said treatments. Now, I agree that physicians need to preserve their credibility and should practice medicine ethically. Although administering a placebo medication involves lying to a patient, it could be argued that sparing a patient from exposure to addictive substances or uncomfortable, sometimes dangerous side effects would actually be the more ethical path. I personally would be okay with being a placebo patient, especially if I experienced marked improvement. If I possess the ability to treat myself, why not take advantage of my own healing power before resorting to an unnecessary medication.